Welcome to RSSDI TV 2020. I am Dr. Ruchi Shah, and on behalf of Wockhardt RSSDI TV 2020, I welcome you all. I am glad to have with us today a renowned endocrinologist from Jaipur, Dr. Prakash Keshwani sir. Sir is a senior consultant endocrinologist and a diabetologist and the senior professor SMS Medical College, Jaipur. Sir has a rich clinical experience in managing diabetes patients. So welcome Dr. Prakash Keshwani sir to the show.
Thank you. Thanks for calling me.
Thank you so much. So, sir, based on your recent talk in the RSSDI 2020 on the SAVOR-TIMI, Examine and the TECOS, which is the cardiac safety of DPP-4 inhibitors, we would first like to know from you, what are the reasons the CVOT trials like SAVOR-TIMI, Examine and TECOS were started?
Because diabetes is such a disease which increases cardiovascular risk by 2 times, and majority of deaths and morbidity is because of cardiovascular diseases. And all of a sudden it happened that few of the drugs which we think that they will help by reducing blood sugar levels, but they will not produce any harm. Particularly rosiglitazone came in the light around 2008 that it also has some cardiac side effects. And for that, drug regulators, FDA and European Medicine Agency, both of them simultaneously in 2008 suggested that all the new anti-hyperglycemic drugs should be given permission only if they are not producing any harm to the cardiovascular system. And previously available drugs were not tested for this, and because of this only this kind of problem occurred. And since then, all the new drugs which are coming to the market, anti-hyperglycemic of any group, they need to be confirmed that they will be not producing any harm to the cardiovascular system, and they should be non-inferior to the placebo, and then only they should be given permission. And that is why this kind of CVOT trials became necessary for launching and selling these anti-hyperglycemic drugs.
Thank you so much, sir. So, sir, the next question will be why cardiac safety is so important with anti-diabetic drugs, and what actually is this bidirectional relationship?
Yes, because diabetes as such causes increase in the incidence of ischemic heart disease, hypertension. It increases around 2 to 4 times. Ischemic heart disease and cardiovascular deaths are 2 to 4 times more common in diabetics as compared to non-diabetics. And this is the major cause of the mortality. And if we think that diabetes is important, which can cause death because of cardiovascular diseases, so it becomes necessary that these cardiovascular diseases should be reduced, and drugs, at least no drug should be used which can cause some morbidity in the cardiovascular system or can enhance the cardiovascular disease, which is already being increased because of the diabetes. So diabetes causes cardiovascular disease, but at least no drug of the anti-diabetic group should produce any cardiovascular disease or increase cardiovascular morbidity and mortality. That is why it is very necessary to rule out any problem which can occur because of anti-diabetic drugs.
Thank you so much, sir. So, sir, the last question, what are the results of these CVOT trials of DPP-4 inhibitors in terms of the cardiac safety?
Yes, 3 important trials which we are going to discuss in our talk is, one is SAVOR-TIMI. This was a very large trial involving more than 14,500 patients, and the drug was used, the sexagliptin, which was an important DPP-4 inhibitor, and the group patients were divided into 2 groups, and they were followed for around 2 years, maximum of 2.8 years, and it was seen that during this period of the time, this drug do not cause any increased incidence of ischemic heart disease, but there was a slight increase of the patients of the heart failure with the sexagliptin. And this drug was found to be non-inferior to placebo in adding to the other anti-diabetic drugs while managing the diabetic patients. Another important trial was Examine trial, which was done with the allogliptin, and more than 6,000 patients were enrolled for this, and these patients were found to have were followed for around 2 to 2.5 years, and they were found to be non-inferior, as there was no increase of the ischemic heart events while taking the allogliptin drug. Another important trial was TICO's trial, in which sitagliptin drug was used. Patients were randomized into two groups, and total of 14,671 patients were enrolled and were randomized into two groups. One was given added with the sitagliptin, while the other group was added with the placebo, and they were followed for around 2.5 years, and it was seen that primary cardiac endpoints were not more in patients who were taking the sitagliptins as compared to placebo. It was around 839 in patients who were taking sitagliptin and 851 who were taking the placebo. And this drug again was found to be non-inferior to the placebo while adding to other anti-diabetic drugs for managing the diabetes. So these three drugs were studied in these trials, and it was found that they are not harmful and they do not increase the ischemic events while giving to diabetic patients. These were the observation of these trials.
Thank you so much, sir, for sharing your views on the CVOT trials of Savertimi, TECOS, and the Examine. And stay tuned to RSSDI 2020 for more recent updates from RSSDI 2020. Thank you very much.
Welcome.